you can't get pregnant, guys and girls. So they're popping up all over the place. So you want to take the omega-3s and you want to be very careful. Again, good for brain, good for nervous system, immune system for shutting the switch off to inflammation. No inflammation, great for joints. Arthritic type pain, going to go away with this, okay? You want to be careful when you purchase your fish oils. We only buy the best. Why? Because the fishing industry has now been known to hold mercury, right? Eating a bunch of fish with mercury in it. So what? What's the big deal? Put mercury in your body. Well, some of us are old enough, I'm not going to say who, but some of us are old enough to remember in school, if you drop a mercury thermometer, what do they do?
We played with it all the time.
Yeah, man. They put on big suits, they quarantine, and then they shut this thing off. Why? Because mercury's poison. It's a heavy metal poison. And what they're finding is if you get a poor fish oil, like I went to Walgreens and got 1,000, I got a barrel, I can eat myself out of it for the next year. If you get cheap fish oils, you are putting heavy metals into your body and you're shooting your inflammation levels up. So that's why you want to get a good fish oil. We recommend Carlson's, okay? And I'll talk a little bit about pricing at the end. So Carlson's, fish oils. The next product we highly recommend, something very simple, is called NAC. It is short for N-acetylcysteine. Big word. Those of you who were in our weight loss workshop about a year ago, you remember we talked about intracellular, inside the cell detoxification, and then outside the cell detoxification, right? What's so important about that? So here's the deal. If the inside of your cells are toxic and the outside of your cells are toxic, that leads to an environment in the tissue called acidity, right? Here's the good news, gang. Heather in a moment is going to pass around a little cup of liquid Drano to everybody, and we're going to drink it. I'm going to take you to the promised land. We're going. Would you do it?
No.
Because liquid Drano is pure acid, right? And so if you drink pure acid, you are going to drop dead. Everyone knows carboxylic acid, but the opposite of that is too alkaline. So you go to a pool that hasn't been touched in 5 years, you open the cover and you go, that thing is so green and nasty, I'm not going near that thing, right? That's too alkaline. Somewhere in the middle, your intracell and your extracellular tissue needs to have the right pH. 6.5 to about 7.5, it needs to be the right pH, right? Because in the right pH, there is no such thing as inflammation. The immune system turns up and you kill every cancer cell, every bacteria, every virus in the body. There's no way anything can grow. That's what research shows. Well then how do we get, and how do you test it? You get testing strips like you test your hot tub, right? You go to bed at night, you wake up in the morning, first thing you do, don't get a drink, don't do anything, go to the bathroom, pee on one strip, put the other strip on your tongue, don't mix them up, the taste is disgusting. And then you match the colors up, okay? And I guarantee most of us here will be too acidic. Remember, acidity in the cell and outside the cell leads to inflammation. Inflammation leads to chronic disease. It is the fire that burns the cells. It is the fire that burns the cholesterol and puts the plaquing on the arteries. It is the fire that burns the joints. Inflammation is deadly. So we talk about in the cell toxicity and out of the cell toxicity. So N-acetylcysteine is an amino acid, an essential amino acid, meaning you can get it in green broccoli and greens, right? We talk about greens for alkalinity. The more raw greens you eat, the better off you are because you start to raise your pH, okay? The more junk food, the more sugars, the more you start to create acidity. But N-acetylcysteine is an essential amino acid, meaning you can get some in your diet, but the rest you have to put in. You have to take this stuff. You have to get it, okay? And N-acetylcysteine is an amino acid that turns into something called glutathione. And glutathione is the #1 antioxidant, #1 cleaner outer and cleaner arounder of your cells. So think of it this way. We don't like the bone and beef restaurant anymore. So what we're going to do is we're going to load it up with dynamite, 3, 2, 1, boom, the whole thing blows up. Well, at the same token, you're going to have some of your cars blow up around it, right? It's not my fault, sorry, you parked there. Bone and beef is going to be internally blown up. Well, we got to clean this site up if we want this area to look healthy, right? So N-acetylcysteine would be taken in, converted into something called glutathione in the body, and glutathione would be the repair crew that would come in, get all the inside the bone and beef stuff out of here, get all your cars out of here, and then lay down a foundation and call the other crew to come on in and start rebuilding. So glutathione is the number one way to clean inside the cells and the number one way to clean outside the cells. It is an amazing thing. I've been doing a lot of research on this over the last 8 months. Glutathione is incredible. The number one antioxidant or cleanup in the cell and outside the cell. It's the number one way when you clean it up to prevent acidity from forming, right? Because if we don't prevent it from forming again, it's going to form again. If we don't prevent it from detoxifying, it's going to toxify again. So the number one way to get inside the cell and the number one way to get around the cell is with glutathione. If you do your own research, you're going to find that they put cancer patients with terminal cancer on heavy doses of glutathione, and the recovery rate is absolutely incredible. Why? Because it goes into the cell, cleans out all the toxicity, outside the cell. Your rate for inflammation goes down. There's no way you can burn that cell because a cancer cell is just an ugly, dying, burning cell, and then just put multiples on there without cleaning it up. You clean it up, there's no risk for damaged tissue. Chronic disease goes away. So it's the number one way to prevent toxicity in the body. The third one is called chlorella. If you've been around my office long enough, you know that I've been speaking about chlorella for 8 years now. Again, what chlorella does is make your body more alkaline. The number one thing Americans do not do is eat enough greens. Green vegetables, green fruits. We don't eat enough greens, okay? We don't eat enough greens, right? The problem with that is the less greens you eat, the more you're making the outside of the cell, the tissues outside of your cell, the more you're making them acidic. And remember, acidity leads to toxicity, which leads to inflammation, which leads to chronic disease. So the number one thing we do outside the cell to enhance NAC is we put you on chlorella, which is an algae. It's sunlight and water. It's an algae. It's sunlight and water. That is the number one way to make your tissue more alkaline. If you're not going to eat enough greens, boom, we put you on the chlorella, decreases your acidity, makes you more alkaline, decreases inflammation rate. Okay? And the last one I want to talk about, or second last one I want to talk about, again, if you were part of our weight loss workshop that was going on, you remember we talked about a product called LArginine. Okay? LArginine is a fantastic company. The only challenge is they keep raising prices on things, and I don't like when a company continually does that. It's not nice. Okay? So we talked about a product called LArginine, right? Now, L-arginine is another amino acid. And this amino acid in the body turns into something called nitric oxide. No, it's not the one you go to at your dentist and you smile and laugh. That's nitrous oxide. And if this did do that, I'd charge you a whole heck of a lot more. This is nitric oxide. So the body converts L-arginine into nitric oxide. And what nitric oxide does is it's called a vasodilator. Big word meaning it takes blood vessels and it opens blood vessels. Well, if I open blood vessels, what's that going to do to the chronic disease called high blood pressure? Well, what is blood pressure, right? Put a rock on a hose, clamp the other end, and then start to blow in the hose. What happens? Things don't move enough, high pressure. So if I open up the vessel, what's going to happen to blood pressure? Drops naturally, doesn't it? So L-arginine is a vasodilator. It opens up blood vessels in the entire body and allows blood flow to increase. Well, now here's the other cool thing. If it increases blood flow, it must increase oxygen to the body. And if it increases oxygen, it does two things. Number one, it boosts your immune system, and you have an increase in something called a respiratory burst. What's a respiratory burst? Well, I'm going to use the analogy. We're all here, and you know what? Some guy walks in, and we're all villains. We're all bad guys, right? We're all bad guys. And there's some other guy out there, and he goes, you know what? I'm taking all the bad guys out. He straps a bunch of dynamite to himself, walks in the office, and boom, right? Takes it out. So a respiratory burst surrounds bacteria, virus, and sites of inflammation, engulfs them, and then blows themselves up into little parts so you can take that inflammation, bacteria, and virus, and store it in your lymphatic glands and get rid of it in your body. Does that make sense? Right? So the more oxygen you have, the better immune system you have. The better immune system you have, the less chronic disease is building because your immune system is fighting that. Number one. Number two, if I can put more oxygen into your cells, especially the fat cells, what are you going to do? Increase your metabolism, and you're going to burn the fat cells, and you're going to lose weight, right? So another thing that L-arginine does, the reason why we had it as part of our weight loss program was because it increased oxygen to the system. And when you increase oxygen, you increase metabolism and you start to burn fat cells. If you burn fat cells, what happens to the chronic disease called obesity? It goes away. Unbelievable, isn't it? And here's the last amazing thing that L-arginine does. So remember I said that you can have a 500 cholesterol and be at no risk for heart attack? Here's the thing, if your numbers are off, meaning, I don't care what your numbers are, but if your ratios and your bad cholesterol and triglycerides are high, if you're inflamed, you are laying plaque in your arteries day in and day out. You are causing heart disease, you're causing high blood pressure because you're plaquing, right? You've got the gasoline, and then you've got the inflammation coming along and blowtorching all this crap all over the arteries, right? Here's the cool thing with L-arginine. L-arginine actually goes into the bloodstream and binds to the garbage in your arteries and literally pulls the garbage out. So you know that thing they call high cholesterol as a chronic disease? What happens to high cholesterol? Goes down, goes away. So you see how we're talking about a few simple products that actually cover the global thing called chronic disease, because chronic disease isn't separate mechanistic points. Chronic disease is just insulin, inflammation, irritation, and what else did I say? Inflammation, irritation,
Insulin.
Thank you. No, wait. Intoxication. Thanks, Rich. All right. So that's all that chronic disease is. So L-arginine, you can look up the studies. They did the studies in the High Desert Heart Institute out in California, which is part of, I think it was, whatever hospital was in California. They took 37 chronically ill congestive heart failure patients. They said, look, we've tried everything. Pacemakers, we're done. You can go home and die now. Literally, they said this. You can find this on YouTube. They said, we're done, go home. What they did was they entered this study with pro-arginine, this product that we brought in, which was basically L-arginine. At the end of a year, okay, at the end of 1 year, one person had dropped out and 35 of them had reversed their chronic heart failure. Isn't that pretty cool? You can look it up online, you can see it on YouTube. So L-arginine turns into nitric oxide, again, which does many things. Vasodilates, drops blood pressure, pulls crud out of the arteries, okay? Increases oxygen, causes weight gain, so you lose weight, decrease the obesity, decrease that weight gain, okay? And the final one is insulin. I want to talk about insulin. We talked about insulin with the stuff that we eat, or listen to this carefully. Everyone goes, well, I must be heavy because of the stuff I'm eating. Listen carefully. If you don't eat, you can get just as heavy. What'd you have for breakfast today, Mary? Oh, no, I don't have breakfast. Whoa. If you start skipping meals, you start throwing your cortisol levels up first, because cortisol will throw blood sugar in if it's not there. Then you'll increase your insulin, then you'll increase your cortisol, and then it's just the reverse, as if putting you too much sugary stuff in. So you gotta make sure that you're eating, especially breakfast. If you don't eat breakfast, you're instantly dumping cortisol in, you're instantly gonna gain weight, you're gonna have low energy, and you're gonna start building inflammation in the body. So we strongly recommend 5 meals a day. Whoa.
Yeah.
Breakfast, snack, lunch, snack, dinner, snack before bed. And if those snacks are tough, like they can be tough for myself, Dr. Francis, and the team over here, they can be tough because we're running around, well, what do? Well, you got to make sure you get that stuff in, so what we strongly recommend is a meal replacement, a protein meal replacement. And we found this about 8 months ago as well. Okay, so we're always looking for the good, right thing, and the reason we started with this is because it's a vegan protein. So anything we can eat without dairy, whey, soy, we stay away from. So this is a beautiful product because it's a vegan protein, okay, and you can use it as a meal replacement. Somebody asked me the other day, well, when do you do this? And I said, you know what? Mondays, Wednesdays, and Fridays in the morning, I have eggs for breakfast. Every Monday, Wednesday, Friday. But Tuesday and Thursday, I don't want to do that. I don't want to overload myself. I'd like to keep it light. So to be honest with you, I use a scoop of this in the morning with almond milk. Okay? The beauty is, it's a vegan protein. 90% of it is organic. And we had the question, Dr. Jeff, the 10%, are you worried about that? Here's the truth. I'm worried about the 90% that's organic. Because USDA, organic, I don't even know if I trust that anymore. So I'm doing the best I can for now until I can get my own farm and start developing my own food products, and then I'll share that with you. But we're doing the best we can right now.
Sorry.
We're doing the best we can right now to help keep your blood sugar levels balanced throughout the day. Because if you don't balance them, again, your adrenals will pump cortisol. High levels of cortisol, and you've seen all the commercials like Corta, whatever they call it on QVC, right? What they're really talking about is cortisol levels pump blood sugar, insulin. You start storing weight here, you start raising your inflammation levels. So let's quickly talk about dosage, and then we're going to move on. So we recommend 2 fish oil a day, about 1,000 milligrams minimum, 2 fish oils a day. Okay, we recommend that, 2 fish oils a day. Here's the cool thing about the N-acetylcysteine. There's 120 caps in here. I recommend 1 a day. 1 a day of the N-acetylcysteine. You only need 500 milligrams. There's 500 in here, so 1 a day of the N-acetylcysteine. The chlorella, I recommend 3 in the morning and 3 in the afternoon.
What does that
Okay?
equate to those?
About 2 grams. Okay? L-arginine, I recommend 2 in the morning, 2 in the afternoon. Okay? About 2 to 5 grams of L-arginine. And I recommend at least once a day. You do 1 scoop. It's going to last you almost 15 scoops. It'll last you about 2 weeks. Okay, so you go, oh my God, Dr. Jeff, that's a whole bunch of stuff to take. Whoa! Well, get this fact. The average American today in 2014 is on 13 different medications. So you're taking pills anyway.